Hey guys, Dr. Ray here from Back Pain Relief Center, coming to you from our South Carolina office today. It is Monday the 20th, and it's about 5 o'clock. I think today's the first day of spring, today or tomorrow, I'm not sure, but hey, we're on that road to getting just a little warmer. So tonight's topic is stiff or frozen neck, or a medical term for it would be torticollis. You know, you ever get that, or you've seen people, I think we all have had it at least one time, where they wake up with a pain in their neck and they can barely turn their head, so very limited range of motion. It gets where if they have to turn around, they have to move their whole body to turn around. It gets really hard when you're driving to look behind or even look in your rearview mirror because your neck hurts so bad. So let's go over what it is and what's going on and how we treat it. And one of the reasons I bring this up is I see this probably once a month, maybe twice a month. It happens to people, and really painful for them, and very troubling because it can be discomfortable. So uncomfortable. So here we go. What is it? Torticollis, or stiff neck or frozen neck, happens when there's part of the joint called a facet joint in the neck, and it's kind of what the joint glides on. And without getting too technical, there's a capsule in there, and part of that capsule can infold and kind of lock up or push inside of the joint or the facet joint that the neck moves, and it causes pain and it inhibits range of motion on the opposite side. And you can have multiple ones, or it can be on either side. So sometimes you might hear a meniscoidal lock or facet lock or torticollis. So they're all big words for saying, hey, I can't move my neck and it hurts. So last week we had a patient come in and it was the same thing. So, hey, my neck's killing me on this side and I can barely move, maybe just a little motion down, a little motion up. And what's happening is part of that facet is being blocked by part of the capsule and it's not allowing them to move it. So what do we do about it? Okay, number one, there's no quick fix to it, and a lot of times they just resolve by themselves. Maybe it hurts you for a week and then they kind of just unlock on themselves. If it's causing you a lot of pain, then come on and see me and we can unlock it. So what do we do there? Well, the first thing we do is a bunch of muscle work, or you may hear of myofascial work or trigger point work or even massage. Anything we need to do to loosen the muscles up in the neck, the upper back, the mid back, the shoulder area, the entire area needs to be loosened up, because when you have that facet lock, all the muscles tighten up because like, hey man, don't move. We don't want you to move anymore because it hurts. So all these muscles lock up. So the first thing we do is try to loosen all that stuff up, and we'll use our hands and we'll do some manual therapy on your muscles. After the manual therapy, we need to put a bunch of heat on it, maybe some electric stim to loosen the muscles, even some cold laser to help reduce the trigger points. So everything we can do to loosen up the neck. A lot of times that alone brings on a bunch of range of motion. Once we loosen things up, the next course of care is a spinal manipulation, okay? Or we're gonna crack your neck. And I know that bothers a lot of people, but it's very safe, it's very effective. And for this, even though it probably doesn't feel like the right thing to do, it absolutely will help. Sometimes we get some patients that are in so much pain that, man, I can't even put my finger on them. They don't want me in a room, nothing, they're just scared. It's very painful. And what we do with those patients is we refer them over to the medical doctors. And the medical doctors typically, what I've seen in the past, they may give them some trigger point injections, they may give them some lidocaine, maybe they give them oral steroid, some muscle relaxers, whatever they think is appropriate for you that day. They'll give you a bunch of stuff, all trying to do the same thing that I was trying to do using my hands. They'll use medicine. And hey, if that's what it needs to do, then that's what we need to do. Because sometimes you're just too sensitive for someone to touch you. Medicine is good first, and then we get on to the therapy part. So an adjustment, although it may not feel like the thing to do, always unlocks them, makes it feel much better. We get that range of motion. So the patient I had last week, we didn't have to get her to the medical doctors. We did a bunch of range of motion stuff on her, so a bunch of manual therapy on her muscles. I manipulated the joint. It was an instant release, and 80% of her range of motion came back. So let's take a step back. Like, how do you get this? Like, why are people getting stiff neck? Well, to tell you the truth, sometimes people just wake up with it and we're not sure why they got it. Maybe they moved a little wrong when they were sleeping. Part of that capsule pushed into the facet and it just locked up. Okay, so we can have an unknown reason. Other times it's a repetitive stress syndrome. So people that work in factories, or not even a factory, or they do the same thing all day. Maybe you're on the phone every day. I turn my head. Every day I turn my head. Every day I'm on the computer. And these things like that can stress the joint, irritate it. It gets that lock, and then you feel the pain. We see it oftentimes in athletes. They'll do a quick jerking movement, or they'll move their head one way or their shoulder, and that joint locks up. And again, it can be very painful. It can be to the point where you can barely move your neck, and it can be a little difficult to get through. My biggest piece of advice with patients is when you do get this facet lock, ice your neck, try to get some of the inflammation down, get in to see me right away. If you want to wait it out, that's great. Wait it out and just give it a few days and see if it goes away. If it doesn't come on in, we have a lot of success in releasing that pressure on the neck and getting that range of motion back. And even with the manipulations and with the manual therapy, it takes a couple of days. So a few days of ice, a few days of biofreeze, maybe a few days of appropriate over-the-counter medication, whatever's good for you, helps it go away. If this becomes a problem that continues to come back and you're having it probably more often than you should, so instead of just a random thing, hey, maybe you're getting it every week, or maybe every Saturday you get it, or every time you work a certain shift, it comes in. At that point, we may be dealing with actual problem with the joint itself. I'd like to see what's going on. We'll come on in, we'll take some x-rays, send you for an MRI, and find out exactly what it is, see if there's any contributing factors, and what we need to do to get you better. All right, so I think that's our talk for tonight. Frozen neck or stiff necks or torticollis. If you have any questions or have any friends or family members that need a consult on it, they can always message me on Facebook. I'm real open with everyone. I return everyone's messages. You can even call me, or you can just stop in the office. I'm in my South Carolina office today and tomorrow down in Myrtle Beach. Wednesday, I'll be back up in Vineland to see all my New Jersey patients. I'll be there all day Wednesday and Thursday. Come in and see me, and we'll get you fixed up. If you have any questions, give me a call or just message me. Have a great day, and we'll talk to you soon. Bye-bye.